Hello everyone. Today, we're delving into the world of a medication called Pradaxa, commonly known by its generic name, Dabigatran. As with all our discussions, this is meant for educational purposes only. If you have health-related questions or concerns, always reach out to a medical professional. Description: Dabigatran, often recognized by its brand name Pradaxa, is an oral anticoagulant that belongs to the class of direct thrombin inhibitors. Its primary function is to help prevent the formation of blood clots by inhibiting the activity of thrombin, an enzyme involved in the blood clotting process. Initially approved by the FDA in 2010, it's primarily prescribed to reduce the risk of stroke and systemic embolism in patients with non-valvular atrial fibrillation, a common heart rhythm disorder. It's also used to treat and prevent deep vein thrombosis, DVT, and pulmonary embolism, PE, in adults who have had hip replacement surgery or knee replacement surgery. Additionally, Dabigatran is used to reduce the risk of recurrent DVT and PE in patients who have already experienced these conditions. Warnings: Dabigatran comes with its set of precautions. It's essential to follow your healthcare provider's instructions carefully. These medications should not be abruptly discontinued without consulting your doctor, as it may increase the risk of blood clots. Dabigatran is not suitable for individuals with artificial heart valves or those with active bleeding conditions, such as gastrointestinal bleeding. It's crucial to inform your healthcare provider if you have any kidney problems, as the dosage may need adjustment. Before undergoing any surgical procedures, including dental work, it's essential to let your healthcare provider and surgeon know that you are taking Dabigatran, as you may need to temporarily stop the medication to reduce the risk of bleeding during the procedure. Before taking this medicine. Before starting Dabigatran, there are several factors to consider. It's important to inform your healthcare provider if you have any allergies to this medication or any other medicines. Individuals with kidney diseases or conditions should discuss potential risks and benefits with their doctor, as the dosage of Dabigatran may need adjustment. If you are pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. Regular monitoring of kidney function, as well as blood tests to check for any potential bleeding issues, may be necessary while taking Dabigatran. Side effects: like all medications, Dabigatran can have side effects. Some common side effects include gastrointestinal symptoms such as upset stomach, nausea, and stomach pain. Additionally, some individuals may experience bruising more easily or notice bleeding from the gums or nose. It's essential to be aware of these potential side effects and promptly report any unusual symptoms to your doctor. Furthermore, there's a risk of severe bleeding, which can be life-threatening. If you experience any signs of excessive bleeding, such as unusually heavy or prolonged bleeding, blood in urine or stool, or if you have a severe headache or weakness, seek medical attention immediately. Additionally, Dabigatran may increase the risk of heart attack or other cardiovascular events in certain patients. Always consult your doctor for medical advice about side effects and report any new or unusual symptoms. Interactions: Dabigatran may interact with other medications or supplements. It's crucial to inform your healthcare provider about all the medicines, vitamins, and herbal products you're currently taking to avoid any adverse interactions. Some drugs may increase the risk of bleeding when taken with Dabigatran, so your doctor will carefully assess the potential benefits and risks of combining these medications. Dosage: correct dosage is vital for the effectiveness and safety of any medication. Always adhere to your doctor's recommendations when taking Dabigatran. The recommended dose of Dabigatran for most patients with atrial fibrillation is 150 mg taken twice daily. For those with reduced kidney function, a lower dose of 75 mg taken twice daily may be prescribed. If you are taking Dabigatran to prevent DVT or PE after hip or knee replacement surgery, your doctor will provide specific dosing instructions based on your individual circumstances. Never alter your dosage without consulting your healthcare provider. Avoid: while on Dabigatran, it's important to avoid activities that may increase the risk of injury or bleeding, such as contact sports. It's also advisable to avoid excessive alcohol consumption, as it can potentiate the risk of bleeding. If you miss a dose, take it as soon as you remember, but do not double the dose to make up for a missed one. FAQ. Many individuals wonder about the duration of Dabigatran treatment. The length of treatment varies depending on the specific medical condition being treated and individual patient factors. It's essential to follow your doctor's recommendations regarding the duration of Dabigatran therapy. Closing. That concludes our overview of Dabigatran, commonly known as Pradaxa. Remember, this information is for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.